Welcome to Medicare, the BFCC-QIO, and You, a Commence Health podcast, where we bring you up-to-date information about QIO services and the overall Medicare landscape. Commence Health holds a contract with the Centers for Medicare and Medicaid Services as a BFCC-QIO, or Beneficiary and Family-Centered Care Quality Improvement Organization. BFCC-QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high-quality health care, and BFCC QIOs like Commence Health protect that right. This month's episode serves as an overview of the QIO program and what services Commence Health provides as the BFCC QIO for 27 states and territories in the U.S. To begin, we're going to share a case study of Commence Health services in action, and then move into a conversation with Lance Coss, the Executive Director of Commence Health's QIO program. The true-to-life story you're about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide help to resolve barriers in care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
Dad had been in the hospital for a while and was transferred to a nursing home for skilled nursing as he continued to heal and recover. After a couple of weeks there, he was discharged home with home health services. Everything up to this point had gone well. He has several health issues, so we've been through the hospital, skilled nursing, home health circle a few times. For the most part, we get through the transitions pretty well, but sometimes there are hiccups. This time, when he was discharged with home health services, we began having problems almost immediately. The doctor had ordered home health for Dad for help with several things, including physical therapy. The home health agency called us and set up a schedule for the aide and physical therapist to work with Dad. They both showed up for the first appointment as scheduled, but after that, we never knew when or even if they were going to show up. Not only was it frustrating, but Dad was not getting the care or therapy he needed. I called the home health agency and left voicemails, but I didn't receive a return call. I finally had enough, and I knew I had to get help somewhere else. I called around and ended up talking to a counselor with the Area Agency on Aging. They told me I could call the Quality Improvement Organization, Commence Health, for help. The counselor said I could file a complaint through Commence Health or ask for an advocate to contact the home health agency for me. They gave me the phone number and I called as soon as I hung up. The advocate with Commence Health assisted me with filing a complaint, but she also offered to further help me with immediate advocacy. She explained the process to me and I consented right away. The following morning, I received a call from the director at the home health agency. He took my information and stated he would address the issues as a complaint. The agency assigned a different aide and physical therapist to Dad, and they both came to the appointments as scheduled. I wanted to make sure that the scheduling issues were addressed both for my dad and for others. Commence Health helped me address both. I was thankful that the counselor with the Area Agency on Aging knew about Commence Health and gave me the phone number, and that Commence Health addressed my issues so quickly.
I'd once again like to welcome Lance Coss to our podcast for a conversation about the QIO program and the services it provides for free to Medicare beneficiaries. What is the BFCC QIO and what is its connection to Medicare?
BFCC-QIO stands for Beneficiary and Family-Centered Care Quality Improvement Organization. It's a national program under Medicare that acts, if you will, as an independent referee whenever a Medicare beneficiary has concerns about the medical care they're receiving. So basically, we make sure that Medicare patients are treated fairly, their rights are respected, and their care meets the highest quality standards. Think of us kind of as the bridge between the patient, the provider, and Medicare.
Why is it important for beneficiaries and their advocates to know about their rights under Medicare?
Well, knowledge is power, right? Too often people don't even realize that they have rights, like the right to appeal if you think you're being discharged too early from the hospital, or the right to request an immediate review if you disagree with a coverage decision. So if a patient doesn't know those rights exist, you can't use them, and that can mean paying for care you shouldn't have to, or even leaving the hospital before you're ready. We want every beneficiary and advocate to know you do have a voice in your care, and we're here to amplify it.
What services do we as the QIO provide?
Great question. We do a lot more than people realize, but our main three services include appeals. So if a patient thinks they're being sent home from the hospital or a rehab facility or skilled nursing or even terminating hospice or home health care, we can step in and review the case quickly for them. What happens is you'll receive a notice of non-coverage from the provider or your MA plan, and it tells you that the services are going to be ending or you're going to be discharged. You pick up the phone, you call the number on that, we'll answer 365 days a year. And what we'll do is take your information, we'll stop your discharge or your termination of service until that provider sends us all of your medical records. And then we do a review with an independent physician out in the community, not related to your case, and they'll render a determination on whether Medicare will continue to pay for those services or not. The other two things we can do is if you're concerned about the care you or your loved one are receiving, we can investigate that independently. Again, it's a medical record review process where we collect all of the information involved in the case. We get your side of the story, we get their side of the story, and we send it again out to a series of independent physician reviewers who will then render an independent determination of whether care is or is not meeting professionally recognized standards of care. And the third thing we can do is something similar, but it doesn't involve the medical record review process, and it's called immediate advocacy. Immediate advocacy is an independent dispute resolution service where we talk to you and then we talk to the provider, sometimes with you on the phone in a three-way conversation, and we explore what miscommunication happened here. I'll give you a classic example. A patient calls us and says, I'm concerned, I just got discharged from the hospital. The whole time I was there, they gave me a green pill, and every morning I take a blue pill. I don't think they treated me right. Well, the easiest thing to do is to get the provider on the phone with that patient and have them explain that their pill was the right medication. They just use a different brand. It's a Pepsi Coke situation. You got the medication appropriately. Everybody hangs up happy. So those occur in the course of 1 to 3 days. Pretty much we can solve the dispute occurring in immediate advocacy. So in short, we protect patients, we ensure their fairness, and we work to improve the quality of care across the entire healthcare system.
So how can a Medicare beneficiary or one of their advocates access these services?
It's actually really easy. There's no red tape involved here. Every Medicare beneficiary gets notices that include the QIO's phone number, and we're just a call away. Some people find us online, others through the 1-800-Medicare helpline number. Now you can actually file your appeal online by going to our website, and we call that e-appeal. It'll ask you the same information that you would be asked by our intake patient service representatives if you were on the phone with us, but you don't have to wait for our call center to be open. You can access that 24 hours a day. When you complete that, it'll start your appeal. We'll record that time as the time you started your appeal, and we'll have all the information we need there. And here's a key point I want to stress. Our services are free. Medicare already covers this, so there's no cost to the patient, the caregiver, or their family.
So what else should beneficiaries and their advocates know about the QIO program?
I'd say two things. First, don't wait until a crisis to call us. If you get a notice about a discharge or you're worried about the care you're receiving, call us right away. I mean, we work fast, but the sooner we get involved, the better we can help you. And second, remember that we're independent. We don't work for the hospital or the doctor. We work for you, the beneficiary. Our only job here is to make sure that Medicare patients are getting the right care and their rights protected like they deserve.
Thank you for tuning in to Medicare, the BFCC-QIO, and You, a Commence Health podcast. For additional information on what we are up to, please follow us on social media at Commence Health or visit our website.